Welcome back to NurseEdScholar. So today we are continuing the Stop Fearing Doses Calculation series. I'm taking it from basic to more advanced. So today I'm going to talk about liquid medication calculations. So, that's your oral liquid medications that you'll be giving your patients. Okay. So by the end of this video, you'll learn how to calculate liquid medications using dimensional analysis. We're going to go over some clinical judgment, some priority actions, and most importantly, patient safety. Now, when you talk about liquid medications, students start to say, okay, this is a little different. It's not a tablet, it's not a capsule. I'm not counting individual things. This is actually measured in milliliters, or you'll see ml for milliliters. And I want you to kind of remember this. Liquid medication calculations are not necessarily harder. They just require you to kind of slow down and ask same questions that we've talked about before. What is ordered? What did the provider order? What's available in your institution or in your hospital? And how many milliliters should I give? And just like every video in this series, I'm not going to only talk about calculating the dose. I'm also going to, kind of connect the calculations to patient safety, try to do some clinical judgment, priority actions, and I try to pick medications that you'll actually see in the hospital. So let's get started. All right. So, tablet and capsule problems usually ask, like I said before, how many tablets or how many capsules I'm going to give, right? But with liquid medications, it's going to ask what's the milliliters, what's the mLs, how many milliliters are you going to administer to your patient? So your final answer should be in milliliters, okay? You know, um, you're going to see liquid medications in a hospital because, sometimes your patients are unable to swallow pills. Some may have feeding tubes um, that you may have to actually put the medication through the feeding tube. Some of your patients may be pediatric patients. Some patients may need a faster absorption route. And so you'll learn, pills is the slowest, and then liquid medication, and then you'll have like sublingual, you'll have, sub-Q and then IV. So, as you move up in complexity, you'll also, that kind of correlates with the route of the route of, kind of correlate with, how fast the absorption would be. And you're going to learn that. With liquid medications, it actually allows you to do a little more precise dosing. You'll see calculations that'll end with like, you know, 20.8, so it'll get, real precise. You may give liquid medications if your patient is nauseated. They may be given post-op. You may give if your patient has dysphagia, so or an aspiration risk. But remember, and we'll talk about that, is that those patients will have a swallow study prior to just make sure that they may not be able to eat solid food, but they may be on like a full liquid diet or liquids with thickener in it, and you'll learn that in school. So I just want you to know that liquid medication math is, just not in the classroom. You're going to actually be using it in real clinical practice. That's really what all this is about. Alrighty. So liquid medication formula is the same formula we've been doing. You're going to have your dose ordered, the dose available in your institution, the quantity, and then how much to give. And so we talked about it. Dose ordered tells you what the provider wants you to give your patient. Um, what's available is what you're going to see on the medication label. That's going to tell you what's available. And then the quantity tells you how many milliliters contain that available dose. And then your final answer should be how many milliliters am I going to give or administer to my patient. Um, and so this is kind of the basic structure. We're going to talk about Dose ordered is always going to go in the numerator. Dose available is going to go in the denominator. And then it's going to be multiplied by the milliliters that the available dose is in. So, and you'll see as we get going. So with liquid medications, um, dimensional analysis is really good. It helps you keep track of the units. And so remember, the milligrams are supposed to cancel out. So the way this is set up, and I did my best to do this, but remember, the dose ordered for this example for acetaminophen was 600 or is 650 milligrams. The dose available is 160 milligrams per 5 milliliter dose. So when you set it up, you can set it up like what I have on the screen, or you could move the milliliters to the side, but it's still going to come out to the same answer. So 650 milligrams divided by the 160 milligrams. Now, that 160 milligrams is available in a 5 milliliter dose. So you will divide 650 milligrams by 160 milligrams and then multiply that number by the dose that's available. So 160 milligrams is per 5 milliliters. And with that, the milligrams are going to cancel out and it's going to leave you with the amounts that you would be giving your patients in milliliters. So just going along, keep moving on. So first you're going to ask yourself, what am I actually solving for? We know that this is a liquid medication, so we'll be solving for milliliters. And when you set it up, it's going to be 600 milligrams divided by 160 milligrams per 5 milliliters. So the 650 milligrams, like I said before, is in the numerator. The 160 milligrams is in the denominator. And then it's going to be times the amount of milliliters that that dose in milligrams is available in your hospital. So 650 milligrams is the dose that's ordered. 160 milligrams is what's available times the milliliter that 160 milligram dose is in. And so when you can do it two ways. You can do 650 milligrams times 5 milliliters divided by 160, and then the milligrams would cancel out, and then you'll solve for your answer. Or you can do 650 milligrams divided by 160 milli 100 650 milligrams, excuse me, divided by 160 milligrams. You solve that first, and then you multiply by what the milliliters that that dose is available. And for this, it's 5 milliliters. And when you solve it, it'll come out to 20.3 milliliters. It seems confusing, but as we keep going, you'll get it. So one thing about acetaminophen, the brand name is Tylenol. You will before you give it, you're going to assess your patient's pain. You're going to assess their temperature, see if they have any allergies, see if they have any liver disease because acetaminophen is metabolized in the liver, and if you have liver problems, it would cause liver failure. If a patient has any alcohol abuse, because same thing, the alcohol will affect the liver, and if a person's liver is compromised, taking too much Tylenol can cause liver failure or worsening liver failure. And then also when the last dose is given, because you want to give it every 4 hours at least apart. And like I said, acetaminophen is metabolized by the liver, so too much acetaminophen can cause serious liver damage or injury. And typically when you see acetaminophen um, oral or liquid, liquid suspension, it's typically in that 160 milligrams per 5 milliliter concentration. So that's why when you see questions with acetaminophen, it's typically going to use that 160 milligrams per 5 milliliter um, concentration because that's what typically is available. And one other thing, a priority with a person who's getting acetaminophen is, if they have severe liver failure or liver damage, um, or has already received the maximum dose for the day, you're going to have to hold it. Typically, you shouldn't give more than 4,000 milligrams of Tylenol a day. That'll all depend. So, you kind of find out from your provider exactly what's the maximum dose. And if that patient has reached that for that day, you're going to definitely notify the provider so they can change the order. Okay, let's move on to another question or another example. Ibuprofen. So the doctor ordered 400 milligrams by mouth of ibuprofen, and the hospital has available 100 milligrams per 5 milliliters. And so, same kind of setup. You'll have the what's ordered 400 milligrams in the numerator, and then the concentration 100 milligrams per 5 milliliters. And you would divide the 400 by 100, cancel out those milligrams, and then multiply it by the 5 milliliter uh, concentration because if the concentration available at your hospital is 100 milligrams per 5 milliliters. So you're going to multiply that number, and for this one, you should get 20 milliliters. So let's look at it. 400 divided by 100 is 4, and 4 times 5 is 20. Kind of simple, but the idea is for you to get used to doing this. Okay, so with ibuprofen, before you want to give it, you really want to assess your patient's kidney function. So you got to look at your labs, right? Are they at any kind of risk for GI bleeding? What's their platelet count? Do they have any allergies? And is the patient on any anticoagulants? Because you have to remember, ibuprofen is an NSAID, and these medications can increase bleeding or even worsen kidney function and in vulnerable populations, right? So if a patient has an active GI bleed, if they have any severe renal disease, renal impairment, or they're at a high risk for bleeding, you want to hold the medicine and notify the provider. And that's why, we always talk about labs, labs, labs. What's, the history of your patient. And this is why you want to try to prevent any kind of injury to your patient. Okay, moving on to diphenhydramine. Um, the brand name for this is Benadryl. So it's an antihistamine. So the doctor ordered 25 milligrams by mouth, and you have available 12.5 milligrams per 5 milliliters. And so you're going to set it up 25 milligrams, which is the dose ordered, by 12.5 milligrams is what's available. And then you're going to multiply that number by the uh, the milliliters based on that dose available in the hospital. So remember, the concentration in the hospital was 800 milligrams per 5 milliliters. And so when you saw that um, um, 25 divided by 12.5 is 2, 2 times 5 is 10. So you will be giving your patient uh, 10 milliliters, excuse me. I got distracted. So, you know, one thing that you're going to have to remember about diphenhydramine is that it's an antihistamine. It can cause sedation. People get dizzy. They get confused on it. They may even be at risk for falling, especially in elderly patients. And so you really want to assess your patient's neural status. What's their level of consciousness? What's their fall risk? Even what's their respiratory status? Uh, because this is considered a sedating medication. And so you don't want your patient to get too sedated. And so if their respiratory status is poor, you may want to call the provider. You know, Remember, sometimes your patient is already confused, especially the elderly. And, even though you may calculate, okay, yeah, I'm supposed to give 10 milliliters, but okay, the calculation is right. But then you really want to look at your patient and you want to say, okay, does this should I really give this to my patient? Is there anything about my patient's status based on my assessment that would make me say, wait, I want to hold off from giving this medicine at this time? Now we're going to move on to uh, Docusate, which is actually, so you'll see that a lot, Docusate sodium. It's used for constipation um, when you see it in the hospital. So this, let's see. The doctor ordered 100 milligrams by mouth, and all you have available is 50 milligrams per 5 milliliter. You set it up the same way. What's ordered is at the top, which was 100. What's available is 50 per 5 milliliters. Uh, so you divide that 100 by the 50, it gives you 2, and then 2 by the milliliters based on that dose available, which is 5, and 2 times 5 is 10. So you'll be giving your patient 10 milliliters. One thing that you need to remember, like I said, Diclofenac sodium is for constipation, so it's a stool softener. Uh, so before giving it, you really want to check your patient's bowel sounds. Uh, When was the last time you actually had a bowel movement? Any abdominal pain, um, nausea or vomiting? You want to make sure this patient doesn't have any kind of bowel obstruction. So, if they are having severe pain, like I said, the nausea, but the vomiting, uh, or anything that make you think, okay, something's wrong. This patient may have some kind of bowel obstruction. Notify the provider. Hold the medicine, because if you give the medicine and the patient already has an obstructive bowel, you're just going to make it worse. So we always assess the patient. Okay, you're going to assess them before you give your medicines. You're going to assess and evaluate the effectiveness of the medications afterwards. Okay, potassium chloride. Now, you will definitely see this medicine. Uh, it could come in. This is a liquid form, but you may see there's like um, you'll see it orally. You'll see it in an effervescent tablet, like an Alka-Seltzer. You put it in water and it dissolves. But in this case, we're going to say, okay, there's liquid. We're giving the potassium chloride liquid, and and you'll find this on a lot of surgery floors because patients lose potassium a lot. Um, so what the provider ordered is 20 milliequivalents. And what's available in the hospital is 10 milliequivalents per 15 milliliters. So setup is the same way. What is ordered is in your numerator, which is the 20 milliequivalents. In the denominator is what's available, and that's that 10 milliequivalents. And so 20 divided by 10 is uh, 2. And then remember, in the dose available, that 10 milliequivalents came per 15 milliliters. So you're going to take that 2 and multiply that by 15. And so you're going to give your patient 30 milliliters. Okay? Hopefully this is making sense. Now, before you give potassium, you have to remember that it affects cardiac conduction, electrical conduction. And too much or too little potassium can cause just horrible dysrhythmias. So before you want to give potassium, please check the potassium level. You want to assess or look up the patient's kidney function. What's their urine output? What's their heart rhythm? Do they have an inability to swallow? Um, or do they have any GI upsets? Because potassium may, make that a little worse. Um, so, I want you to remember that if the potassium level is high, the patient has poor urine output, the kidney function is, not the greatest, you want to hold it. You want to hold it and notify the provider. Like I said before in another video, you just don't want to give medicines blindly because it's ordered. You really want to make sure that, can I give this patient this medicine at this time? You calculated it correctly, but can you give it? Remember, The kidneys help remove potassium, and if the potassium, Lord, if the kidneys are not functioning properly, then that potassium can build up and it'll affect the patient's, cardiac function. So that's why, we always ask, what's the labs, what's the patient condition, what was the patient assessment before you give medications. Okay, so a lot of the times you'll be giving medicines, you may give it in a medicine cup, but a lot of times you'll give it in an oral syringe. And that oral syringe really helps you measure liquid medications, accurately. Um, and it's great, they're great for like smaller, or like we said before, precise dosages. Um, and it's actually safer than a medication cup because, trying to read the lines on a medication cup. You know, um, Research says that using a syringe helps reduce medication errors or dosing errors, um, especially when small amounts are involved. So, we talk about milliliters, but we're not using a teaspoon, we're not using a tablespoon. You want precise dosing. Um, you want to, like we always do, you want to verify the dose uh, before calculating. You want to know the concentrations before calculating the dose. You want to make sure you look at the label correctly because sometimes and when you're moving fast, you know, sometimes you can get used to seeing a certain dosage on the labels and just it's just repetitive. You just kind of repeat, oh, it's this. But then if the hospital runs out of the regular concentration of a medicine, that can really cause a problem because you may actually be giving too much or too little. So you really have to um, watch the medication labels. Another thing is, this is gonna sound real strange, but you can't give liquid medications IV. To you, it may seem like a no-brainer, but it has happened in practice. Please do not give oral medications IV. Always make sure you use the correct route. Okay. All right. Let's move on. Lactulose. Your provider ordered 20 grams PO, and what's available in your hospital is 10 grams per 15 milliliters. You set it up the same way. What's ordered at the top, 20 grams. What is available is 10 grams. The grams cancel each other out. It's two, and then what's the milliliter of that concentration that's available in the hospital is 15. And so the answer is 30 milliliters. So why do we give lactulose? Lactulose is used for constipation, but in the hospital, you may see it for hepatic encephalopathy. Um, with hepatic encephalopathy, the liver isn't clearing the toxins effectively. So lactulose kind of reduces that ammonia buildup that's causing confusion in your patient through the GI tract. So it'll remove ammonia through your stool. And so lactulose helps you go and pull the ammonia with it. Okay. So before you give lactulose, you want to assess the patient's mental status. If an ammonia level is ordered, please look at it. If it's not ordered, you may want to call the provider and say, hey, do you want to check an ammonia level? You want to see how many times the patient has had a bowel movement. Do they have diarrhea? Because if you give too much lactulose, the patient's going to have a lot of diarrhea. So it's kind of a pro and con. You want to call the doctor and say, okay, hey, the ammonia level's this. The patient is having a lot of diarrhea. What do you want to do? And then you just kind of, go from there. You want to check for dehydration. Definitely electrolytes because the person's going to be having a lot of diarrhea. They're going to be losing a lot of fluid through their stool, and that may throw their electrolytes off. So there's another reason why you want to make sure that you know your um, labs. Okay. So, and then of course, check the labs, assess your patient, notify the provider. Okay. Throwing little pediatric calculation, liquid calculation, where this is not a pediatric video, But, nursing students, nurses have to understand liquid medications because pediatric patients typically take liquid medications. So for this one, we're going to be using amoxicillin, which is a penicillin. Um, and the doctor ordered 250 milligrams. And what is available? 125 milligrams per 5 milliliters. You set it up the same way, 250 milligrams in the numerator, 125 in the denominator. You're going to cancel them out. And then you are going to, and that'll be two, and then you're going to multiply that by the milliliters. So that'll give you 10 milliliters of amoxicillin that you're going to give your pediatric patient. And one thing you want to remember about amoxicillin is that you always want to assess allergies. What are the allergies on the chart? If the family member's in the room, you just want to double check. If the mother's in the room for a penicillin allergy, does the patient have a current infection? Because typically that's why you would want to give the antibiotic. Can the child or patient swallow? And then a lot of the times, um, amoxicillin is when it's created by the pharmacy, you have to shake it up because it's the powder and then the liquid together. So to make sure that the medication is distributed through the liquid, you may have to shake it up. Okay. Um, but when we talk about allergies, of course, if a patient has a penicillin allergy, we will not give the medicine. We want to hold and notify the provider. I will say one thing about this, and this is anything when it comes to allergies. There are times um, in, in nursing programs, I can definitely tell you, in mine, we have created an entire scenario of what the patient's going to get and all this kind of stuff. And then we have what are you going to give the patient, and we have all of these answers. And the answer is typically, well, not typically, but in this scenario, the answer is you won't give them anything. You're going to call the provider. And a lot of times students miss because they don't look for the allergies. So you always want to make sure that you look at the allergies. I just want to throw that in there. All right, so let's look at an unfolding case study. Um, and this kind of brings, kind of what you may see in the hospital. So you have Mr. Carter. He is a 68-year-old patient admitted with pneumonia. And he's having some difficulty swallowing after a stroke. So the provider orders acetaminophen liquid for Mr. Carter's fever. And you check a temp. His temp is 101 points. He's coughing and he has dysphagia. And so you're like, okay. So the dose that the provider ordered was acetaminophen 650 milligrams, and what's available is 160 milligrams per 5 milliliters. Now, of course, you want to assess your patient and you want to realize, okay, so the patient has a fever. They have a diagnosis of pneumonia. They have dysphagia, and that's going to definitely put them at an aspiration risk. You have some liquid medicine that is ordered, and you're going to have to check the patient's labs because you really want to make sure that that patient's liver profile is safe to give the medicine. So with calculating the dose, you have 650 milligrams that you need to give, and what's available is 160 milligrams per 5 milliliters. So you're going to put that dose that's ordered in the numerator, that's 650. You're going to divide that by what's available is the 160 milligrams, and then you're going to multiply that by the milliliters of the available dose. And so you're going to get 20.3 milliliters. Now, when you perform the math is correct. The best way you would give 20.3 milliliters would be using a syringe. Um, but let's think about this. You really want, you figured out the calculation. You know the patient needs it because they have a temp, 101.8, right? But should you give it? The patient has dysphagia. That means that the swallowing is impaired. The patient is having difficulty swallowing, which will make them at an aspiration risk. It's going to increase that aspiration risk. Okay. So what do? Before giving the medicine, you need to verify if they even you want to verify the swallowing precautions, but you want to make sure that they even ordered a swallow study, right? Um, and did speech therapy, because typically the swallow studies are done by speech therapy. Did they say it was safe for this patient to have liquid medication? Because if your patient is coughing when they're trying to drink the liquid, or and that coughing may prompt, hey, I may need to tell the provider this patient may need a swallow study. Or if they've had one done and they failed the swallow screen, you're going to hold the medicine. You're going to notify the provider. You're going to find another way to give your patient some medication to reduce their fever. You know, Giving liquid is easier to swallow than a tablet, okay? But even liquids can cause an aspiration risk, especially in patients that have dysphagia. And I'm saying all this because the correct dose is really not enough. You have to make sure if it's safe to give it. And then after you safely give your medicine, of course, we're going to go back and reassess that temperature. It should go down. You're going to reassess the patient comfort level, swallow tolerance, and their respiratory status. And the reason for respiratory status is because the patient, you may give them the liquid medicine and they may not show any signs of coughing, but they may still aspirate the medicine. So you want to assess their lungs to make sure that they didn't aspirate. So it is very important to always, like we say, assess, administer, assess and evaluate. All righty, we're close to the end. So, common mistakes that students make. Mistake number one, okay, they flip the fraction. So, you know how we say what is ordered is always in the numerator and what is available in the denominator? Well, sometimes students flip them, okay? And this will give an incorrect answer. And and with it, the patient's not going to get their correct dose. Students may just forget the quantity. The label says 160 milligrams per 5 milliliters, and that 5 milliliters really counts in your calculations. Um, they may round too early. Um, when you're doing calculations like this, you want to make sure you have all of the numbers and then you round depending on, the instructor, depending on the course, they may tell you to round to the tenth place. Sometimes you'll see them round to the hundredth place, but stipulate maybe the tenth place. They may even say a whole number. You just have to make sure that you are following your school directions and then the facilities protocols. Let's see. Another mistake is they ignore the route. Like I said, an oral liquid is not IV. And like I said before, students try to give oral medicines IV. I just don't understand why, but they do. And you will get kicked out of school, and if you're a nurse, you'll lose your license and you can, kill your patient. So just remember that, you know, just because you can calculate medicines, you still have to use that clinical judgment to make sure, should I be giving this medicine to this patient right now? Let's talk about decimals real quick. Um, you know, Decimal safety is very important with liquid medications. Um, you should always have a zero before a decimal. You should never have a zero after a decimal. Um, Joint Commission and other, organizations, you know, they they say that the problem is that um if you have if you make a mistake with the zeros, right? What it can do is make your calculation 10 times worse. Um, so like on the screen, we see if you don't have the 0.5, and you only have the point 0.5, then somebody looking at the order, or you as the nurse looking at the order, you may not see that decimal, and you may give the person 5 milliliters instead of zero point 0.5 milliliters. Or if you don't put the zero after, not after the, I'm sorry, if you put the zero after, like the 5.0, sometimes people may not see that decimal in between the 5 and the 0, and they give their patient 50. And so that's the real reason why they want you to put the 0, before the decimal, but you don't want to put it after the decimal because it really changes the concentration of the medicine that you're giving. And that's why this is so important. I mean, I know that we're going over simple questions, but it's, you really have to take your time, when you're performing calculations. All right. So I have some questions at the end. Um, I um I don't have them how to set up, and I don't have an answer. So this is for you to practice. So we have guaifenesin, which is an expectorant. It's used for chest congestion. So the provider ordered 200 milligrams, and what you have available is 100 milligrams per 5 milliliters. So grab a piece of paper. How would you set it up? And what is your answer? Okay. So I hope you got this, ooh, this answer. 10 milliliters. All righty. Um, One thing to know about guaifenesin, you need to assess the patient's cough, um, secretion thickness. It's an expectorant, so you want to make sure the patient is hydrated so they can liquefy those secretions so they'll be able to cough and clear those secretions. All right, let's move to the next practice problem. Okay, the doctor orders Senna. Senna is used for constipation. The order is 17.6 milligrams, and what you have available is 8.8 milligrams per 5 milliliters. In your paper, set it up and figure out your answer. All righty. So hopefully you got this. I didn't mean for them both to be the same answer. All righty. So, before you give Senna, we said it's for constipation, you want to assess your patient's bowel pattern. Do they have any abdominal pain? You want to rule out any kind of bowel obstruction. You want to make sure, see if their abdomen is distended. Okay. And I have one more practice question. All right, ferrous sulfate. You'll see this in the hospital. It is used for iron deficiency anemia. So the order is, oh, and this was kind of simple. The order is 220 milligrams, and all you have available in the facility is 220 milligrams per 5 milliliters. Set it up, and but I don't know. This one's a little easier. I don't know, but set it up, and you may be able, could have done this in your head. So I'm going to go on ahead and write the answer. Okay. All right. So the answer is 5 milliliters. 220 divided by 220 is 1. 1 times 5 is 5. So you're going to give your patient 5 milliliters. One thing to know when you're giving ferrous sulfate, you want to check the patient's history. Do they have a history of anemia, um, GI tolerance? So ferrous sulfate can make you constipated. Uh, so you want to teach the patient to drink lots of water. Also, you want to teach your patient that iron can darken the stool. So especially like with a lot of older people, they're very aware of their bowel habits and stuff. So you want to really make sure that you educate them appropriately. All righty, we've done a lot today. Covered a lot in the liquid medication calculations, using dimensional analysis. Um, with liquid medications, it'll always ask for milliliters. Um, like I said, the dose ordered always goes first. The available is always in the denominator. And then, you always want to make sure you have that milliliter that goes along with that available dose. The units should cancel out other than your milliliters. Um, and, remember, like, I've been saying, nursing doesn't stop after the math. You still have to make sure that you assess your patient and make sure that what you're giving them is what they need at that time. Okay, you want to make sure you assess them, assess the route, check for allergies, look at their lab work. You want to do all of these things to make sure that it's safe, that you're giving the medicine that you just correctly, you know, uh, calculate. Okay. And that is it. Thank you for hanging in there. This has been a long one, but I wanted to make sure that you had enough examples. You kind of get in the rhythm of this is how um, I set up my calculations for the medications that I'll be giving. So if this video helped you understand liquid medication calculations, please please subscribe, turn on those notifications and subscribe to Nurse Ed Scholar. Share it with a student in your class that may be struggling. Every video is going to get a little bit more difficult, more challenging. I'm just trying to break it down so in the end you'll be like, I got it. Okay. So I just want you to comment which is harder for you. Is it tablets, liquid, IV calculations? We're going to be doing some yeah, pump rates and flow rates soon. So I still have a lot more to go. And so in the next video, we're going to continue building your confidence. We're going to talk about injectable medication calculations and medication safety. All right. So just remember, dosage calculations is not just math. It's all about patient safety. And so happy studying from Nurse Ed Scholar.